first. Just sorry. Yeah. So is it visible?
Yes, sir. Yes, sir.
The PPT is visible?
Yes, sir.
You need to maximize
Okay.
that.
Okay. So if you see, these are the different conditions where this Abhyantara Snehapana is given. So if you see the indications before Shodhana, you can see it is like Swedya and Samshodhya. And in the different stages of life, if you see it is like for Vruddha and Bala. In different conditions, if you see Ruksha, Krisha and Abala. And in different
Excuse me,
Vihara,
sir.
if you see Vyayama
Excuse-
Nitya, Madhya Nitya, Stri Nitya, and Krisha and Abala. In different disease conditions, if you see Vata Vikara, Kshina Shrik, Kshina Ratasa, then Abhishyanda and Timira. Okay. Then what is Acha Sneham? Okay. So Acha Payastu Sneho Tamahur Vicharnam Snehasya Avidrishta Kalpaha Pradama Kalpikaha. So this Pradama Kalpikaha word is very important because many people ask, you have Sadhya Sneham, you have Vicharna Sneham, you have Uttarabhaktika Sneham, you have different Snehas, but you can see if somebody wants to achieve a very good and great results, okay, if somebody wants to achieve a very good and great results, Pradama Kalpika, Achapeya is the Pradama Kalpika, the best and foremost is Achapaya only if you want to get the best results. So that's why this word Pradama Kalpikaha is mentioned. So like all other Snehanas you can use according to the patient condition, according to the necessity. But if you want to achieve the great results, okay, Achapaya is the only way to go. That's why they said about this Pradama Kalpikaha. Okay. Then Achapaya.
Sir, sorry to disturb you.
Yes, sir.
Please make slideshow so everyone can.
Maximize visible, sir. View hits.
Slideshow.
Share.
Full screen it should be.
Slideshow. Yes.
Yes.
Thank you, sir.
Okay. So Achapaya. So that means which is not mixed with any other thing. Acha means pure. Okay, that's why you see Chakrapani says Odanadi Asambandhi Sati Peyaha. So which should not be mixed with any other, any other substances. It is like pure, very pure form of it's like very pure form of fat drinking. So where you don't mix any dravyas. It can be any prakshepa or it can be any any dravyam. Okay, so it should be pure form. Okay, so here one Dalhana clearly explains basically whether there is always one debate is going on. It is always throughout the India whether we should go for processed ghritam or thailam. Okay, samskarita ghritam or samskarita thailam are very pure form of fat drinking should be given. Okay, this is always a debatable topic. But if you see Dalhana commentary, he says, okay, this particular word he is saying that prakshepa rahitam sarpihi. Okay, prakshepa rahitam sarpihi uses, but he says either it can be process samskaritam or samskaritam va. These two words he is using. So you can see very clearly if you read in between the line, this prakshepa rahitam sarpihi means when you give snehapana, you should not add any prakshepa dravyas. Whereas Samskaritam or Samskaritam, either it can be processed or unprocessed Gritam can be, or Snehana can be given. So it is very clear that it can be given either processed or unprocessed. So the interpretation what I always believe is, for Swastha person, we can always go for Asamskrita Gritam or Thailam, whereas our Murchita Thailam or Murchita Gritam, once again that became processed only. Okay. Then if you want to go for the disease, or if you want to give it a person who suffers from disease, then we can always go with the Samskaritam Gritam only. Okay, because why I say the Samskarita Gritam, if you see every end of the chapter, Charaka Samhita, Sushrutam, they end with the Gritam and Thylams, right? So basically, some people consider it as like it is for Shamana purpose, it is not for Shodhana purpose and all. But basically, what I believe is, since Acharyas has told, if it is only pure Gritam, then why should these many Gritams or Thylams should be mentioned for Snehapana, which is not necessary. And one more thing, if you see Pandu disease and all, Pandu Mahakalyanakama, slokam is there. Okay, so this slokam in one or two diseases only they say about Ado Pibet, then all other diseases it comes the end of the this one. But still, if you read in between line, basically always in a deceased person, I go with Samskaritam Gritam only, because what I felt is it is giving good results. Okay, when you give the Samskarita Gritam, it is giving good results. Even you will see some kind of take the example in Tokavikaras and all, easily you will find out when you give Aragata Mahatiktakam and other thing in psoriasis, whereas if you give the normal Gritam, the improvement is obviously seen. So after that, what I've decided is, finding out these small, these references also. So I came to the conclusion that, it is always for a Swastha person, if you want to go for Panchakarma or Snehapana, go with Asamskritam, Gritam or Thailam. Whereas for Athura person, it is always go with the Samskaritam, Gritam only. Okay. So this is about Achapaya. So Vadanadi Asamanda, okay, unmixed pure form of fat administration is called as Achapana. Okay. Then in the nutshell, okay, if you say Achapana, it is administered internally, used for Shodhana or Shamana of dosha. Okay. Definitely when you are giving for Shodhana or Shamana of dosha, Patya must be followed. Large dose is given. Okay. So these are the in nutshell where we give Achapana is. So it is administered internally, used for Shodhana or Shamana purpose of dosha. Patya must be definitely followed and large dose is given. Okay. So if you see, what is the difference between Shodhana Acha and Shamana Acha Sneha? If you see Madhyama Matra, if you see the Matra, according to Charaka, it is Madhyama Matra. According to Vagbata, it is Uttama Matra. I don't know. There is no clear-cut form of explanation is there why these two acharyas differ, in this Matra. But always, for dosha Shodhana purpose, because you want to do Shamana, so always the best dose, this is my interpretation, always the best dose should be given. And for Shodhana, Madhyama Matra is enough. Okay. Then duration, if you see 3 to 7 days, and here Shamana Sneha till Vyadi Shamana. But if you see, read in bit, this is like practically we give this till Vyadi Shamana. But if you see, this till Vyadi Shamana word is not at all appearing in any kind of Brahatrayas or Lahutrayas. According to our Acharyas, you give any form of Snehapana, it should be maximum of 7 days, minimum of 3 days. That's it. Okay, it can be Shamana Acha Sneha, it can be Shodhana Acha Sneha. Later, we started giving very less amount of Shamana Acha Sneha. That's why, we started to say that it is still Vyadi Shamana. But practically, if you say, if you are giving Uttama Matra, which is digested in 24 hours, okay, then Patya also should be followed. Then maximum it should be given 7 days only. So the main difference is in Shodhananga Sneha, we give Arohana Karma, whereas in Shamana purpose, we give in the fixed dose. Okay, as simple as that. So though we say till Vyadi Shamana, but if you see in between the lines, there is no clear-cut, perfect or evidence or clear-cut explanation, or there is no evidence that it should be given till Vyadi Shamana, because according to Acharyas, it is like 3 days or 7 days only. Okay, next if you see time of administration, so fixed time early in the morning, whereas Shamana Sneha when there is a good appetite. This is very important. Shodhananga Snehapana always given in the early morning, whereas Shamana Sneha, they don't say the criteria of this early morning and all. Shamanaha, Kshuddvato, Ananno, Madhyama Matra. Okay, when the person is Kshuddvata, it can be afternoon, it can be evening also. This is a very clear-cut explanation, because this is very important. So you give the Ghritam is same. So there are 2 criteria. When it will act as Shodhana, when it act as Shamana. Okay. So depends on the dose and the time of administration only. Okay. Depends on the dose and time of administration. The particular given Sneha either can do Dosha Shamana or Dosha Shodhana. So the 2 criteria for doing Dosha Shamana or Dosha Shodhana is basically time and dose. So according to this time and dose only, given Ghritam or Thailam will act as Shamana or Shodhana, which is very important. Keep it in your mind. Okay. Then Anupanam depends on Sneha. Then here Shamana Sneha depends on Roga. Then Samyak Snigdha Lakshanas, most of the Lakshanas are visible, whereas in Shamana Sneha only certain Lakshanas are visible. Then post therapy followed by Shodhana, whereas in Shamana Acha need not be followed by Shodhana. Okay. Then if you see intake of, this is once again already I explained whether, Samskritam or Asamskritam. So this is, you can see basically Kevalam Paitike Sarpir Vatike Lavanan Vidam Deyam Bahukape Chapi Yoshakshara Samayutam. Okay, you see this quotation only. It's very important. Just see Kevalam Paitike Sarpi Vatike Lavanan Vidam Deyam Bahukape Chapi Yoshakshara Samayutam. You can see this particular sloka, it is clearly saying we should never go for except pitta condition. Even in pitta, they are say tikta dravya processed with trakta dravyas. That's what Chakrapani says. Okay, processed with tikta dravyas. Okay, clearly it is mentioned. So basically, if you read in between the line, they don't advise. Okay, especially when it comes to Ghritam, they don't advise, or in case of any Sneha, they don't advise to give Kevala. You can say Sarpir Vadike Lavanan Vidam along with Lavana. Then Bahukapechi Vyosakshara Samayutam. So always you see there is some kind of medicine is always added or processed here. Okay. So this is one clear-cut explanation that Acharyas are trying to give us, that it is not advisable. This is my interpretation. People may not agree or may agree. So Acharyas are clearly they are saying that it is always better to do Samskara Ghritam only. Okay, for Dosha, Shodhana or Shamana purpose. Okay, you can see this. Then yeah, so you can see Kevalam Asahayam. This is what beautifully Adalhana said. Kevalam Asahayam Anyadraver Samyuktam Idyarthaha Tacha Samskritam Asamskritam Va. You can see Tacha Samskritam Asamskritam Va. Okay, Satyapi Anyadravya Samyoge Samskaratum Labhyata Eva Samyoga Samskarayor Gunantar Binnatum Yetena Samskritam Asamskritam Va Kevalam Kvata Churnadi Prakshepa Rahitam Sarpihi. This is very important. Kvata Churnadi Prakshepa Rahitam Sarpihi Petam Petavyam iti Nyeyam. You can see, so there should not be any Prakshepa Dravyas. Tacha Samskritam Asamskritam Va. So these 2 words are important, because Samskritam, Asamskritam or Prakshepa, you see this be Anyadravya Samyoga Samskritam Labhyate Eva. Samyoga Samskarya Gunor Binnatum. So when you do Samyoga, it acts differently, whereas when you do Samskara, it acts differently, because both are different. That is the reason why there should not be added with any Praksheparahitam Sarpi. Okay, whereas Sanskritam is always better. Okay, so Gayadasa reads, if you see, Pitta Hara Dravya Sadita Meva Kevalam Ityaha. Kevalam Paitike Sarpir we read. Okay, then Pitta Hara Dravya Sadita Meva Kevalam Ityaha. So Kevalam means it is not the pure form of Gritam or Tailam. It is like Pitta Hara Dravya Saditam Eva. So it should be given after processed with Pitta Hara Dravyas. So it is clear-cut evidence and clear-cut explanation is available that, in our text. So always it is better to, for dosha shamana or dosha shodhana, better to go for samskarita gritam only, whereas in swastha person, we can always go for unprocessed gritam or tailam. Okay. So hence it can be understood from the word Kevala is drinking gritam or tailam, divide of Kvata, Churna, etc. Prakshep Dravyas. Okay. Then if you see next is Achapana Kala, duration of Achapana. Okay. According to Charaka, Snehasya Prakarshotu Sat Triratra Saptaratrakau. Okay. So basically for Mritukoshta, it is 3 days, and for Krura Koshta, it is 7 days. Then about Madhyama Koshta, for that Arunadatta clearly explains Madhyama Koshtastu Shadaham. Okay. So maximum by 6 days, Madhyama Koshta. Even if you see in Ashtanga Hridaya, it is mentioned, even it is like 5 days to 6 days. Either it can be Madhyama Koshta person will get some mixed Snigdha Lakshanas in the 5th day or the 6th day, whereas the Krura Koshta person, definitely if you administer proper dose, if you administer, at the proper time, only in the 7th day, you will get some Snigdha Lakshanas for sure. If you, with the same with Mridu Koshta person, if the dose is fixed properly, if the dose is, fixed properly, and if it is given proper time, okay, then definitely in 3 days, he will get Samyak Snigdha Lakshanas. Okay, this is very clear. Madhyama Koshta person in 5 days or 6 days. Okay. Then if says what to do if you don't get Samyak Snigdha Lakshanas in stipulated time. But I always believe and I always state to my students, if you fix the dose according to the Koshta and Agni, and if you feel, if you give it in a proper time, I can assure you that definitely in a stipulated time you will get Samyak Snigdha Lakshanas. If you are not getting Samyak Snigdha Lakshanas, means you have given the inefficient, dose. The dose is not proper. That is the reason why you are not getting Samyak Snigdha Lakshanas. Okay. So basically, if you see in Siddhisthanam, some Chakrapani quotes, he himself don't say. Chakrapani quotes other acharyas. He says other people do Snehapana 9 days also if they don't get Samyak Snigdha Lakshanas. So what he says, so other people do it for 9 days, but it is Acharya Viruddhameva, Sada Viruddhameva. It says it is against of Acharya's rule. Hence, I don't agree with that. So basically what he says, he give Dinamekam Vishramya. Okay, Dinamekam Vishramya, Punaha Sneham Yojayatidi. So if you don't get Samyak Snigdha Lakshanas in stipulated day, stipulated time, then give 1 day break and, okay, start with proper dose or higher dose. Okay, then definitely you will get Samyak Snigdha Lakshanas. Okay. Then basically, if you see the time, Dwabhyam, so Achapana time. So we have seen that when it should be given the maximum time period, like the days. Now we will see the digestion hours. Okay. Now we will see the digestion hours. Dwabhyam Chaturbai Ashtabir Yamir Ya Jireti Ya. Okay. Kramat. Viswa Madhyam Uttama Matras Tastabhyascha Risiyasim. Kalpet Vikshya Doshadin Pragevatu Risiyasim. Okay. Dosha Kala Vaya Agni Bala Anala Yogya Yojiyet Hinascha Madhyam Jeshta Matra Snehasya Buddhiman Bhava Prakash. Okay. So if you see, so basically the dose is explained as Rishiyasi Matra, Viswa Matra, Madhyama Matra, and Uttama Matra. Okay. So dvabhyam chaturbir ashtabir yamayat. So the dose which is digest, even less than 2 yama, you can say it is like 1 yama. Okay, then it is, you can say it as S.J.A.C, which is digested in 2 yama, then Risva Matra, then which is digested in 4 yama, it is Madhyama Matra, then which is digested in 8 yama, that is 24 hours, is called as Uttama Matra. Okay. So the beauty of Snehapana is that there is no specific fixation of dose of unctuous substances in terms of quantity for all individuals. Okay, you see in later authors like Sharangadhara, Bhava Prakasha, they have mentioned quantity wise dose. Okay, like Irso Matra is this much, Madhyama Matra is this much, Uttama Matra is this much quantity wise. Okay, but in Brihatri times it is not at all mentioned. And I can tell you, if you follow that quantity wise, you will not get Samyak Snigdha Lakshanas. Maybe I always felt that those quantity wise mentioned is for Shamana Sneha, not for Shodhananga Snehapana. That's what I interpreted. Okay. So the standardization of doses in metric system is not at all possible, as it has been told in the classics to fix the dose as per the individual needs. Fixation of dosage of Snehapana numerical value is not possible because the dose will vary from person to person based on dosha, koshta, agnibala. So this slide is very important. So it is standardization is very especially in metric system is very difficult. Or how we can standardize? No, it is possible. I'll tell you how it is possible. So we need to find at least with one person in the same BMI, same age, and same weight. So if you give the same amount of Snehapana in 5 people, like same BMI, same height, same weight person, if you give Snehapana and you see in within how many days, and Koshta also, yes, Koshta and Agni. So if you see, if it is getting, if he or she is getting Samyak Snigdha Lakshanas in particular day, like 5 days or 6 days or 7 days, then you can segregate those people, like, this height, this weight, this quantity of Agni, this quantity of Koshta, then accordingly we may standardize. Okay, for these particular set of people, those who have this much height, this much weight, this much sleep, so we can make a criteria, and for those people maybe we can fix the dose and give. Then definitely there are chances in you can standardize the Snehapana in a metric system. That also I'm not sure. Only PG and PhD studies, those who have, they can see, they can get this idea. If not, definitely we should go with according to the Agni Bala and Koshta Bala only. Then only you will get Samyak Snigdha Lakshanas. Okay. Then Anupana for Achasneham. Jalam Ushnam Kritepayam Yushaistu Taile Anushasate Cha Vasamajjastu Mandahasyat Sarveshnu Ushnam Ambu Atava. So best is Ushnambu for everything. Okay. Ushnambu is best for everything, but depends on the doshas. They have given specific Anupana also. So Yusham for Vata and this Mandam for Vasa and Majja. Okay, which is for Kapha dosha. Okay. So Ushna Jalam is a universal Anupana for any Sneha Dravyas. It helps for the disintegration of fat, helps in the better absorption of the given Sneha. Ushna Jalam should not be advised for Snehas of Ballataka and Toraka because both are Ushna and Tikshna in nature. So except Ballataka and Toraka Sneham, Ushna Jala can be given to any Krishna Jala as Anupana can be given to Girtam, Tailam or Vasa Majja. It's a universal Anupana. It helps to disintegrate the Sneha Dravya. So why they said about Yusham, if you see, Yusham is very good Anupana for Vata. Yusham contains more protein and alkaline and more protein, and Yusham is alkaline in nature, and it counteracts the Vidahi nature of the Thailam. Okay, that is the reason why. And Yusham is more starch. Vata, it is it needs energy always. Because what happens when there is more Vata, the person will have already basically what happens, you get this dehydrated symptoms. Okay, in Vata persons, if you give Snehapana, if they don't take starch, because during Snehapana, the food amount is very less. we give very little amount of food. So basically the ketosis takes place, and basically dehydration symptoms comes, especially in Vata person. You see this dehydration symptoms very more because he will develop this dryness of throat. The skin will be very, very dry. So we need to give more, starch, or we need to give more carbohydrates. So this Yusham is more protein also, along with the rice also we give. Then it gives immediate strength to this person. That's why Yusham is told for Taila. Okay, Yusham is told for Taila, and once again Yusham counteracts the Vidahi nature of the Taila. Hence, Yusha is mentioned when you give Taila as Snehapana. When it comes to Vasa and Majja, they are Gurutama in nature. So, Lagu Anupana must be given. Mandam is simple starch and digested very easily. It is like water. Okay, it is very watery in nature. It is easy to digest because Masa and Majja is very, very Gurutama. It is heavy in nature. That's why we cannot give any heavy Anupana. We have to go for very simple Anupana. Manda is very simple and it is very, very light in nature. That's why for Vasa and Majja, it is Mandam is advised. Okay. Then now we will see Shamana Sneha. Okay. Rogasya Shamanartham Ubinjamana Sneha. Okay. The Snehapana, which is used for the alleviation of the vitiated doshas. Okay. What it does? Dosha Anukarshani Matra, Sarva Marga Anusarini, Balya, Purnarnavakari, Sharir Indre Chetasam, Charaka Sutram 13/34. Okay. So when a Shamana Sneha is administered properly, Dosha Anukarshani Matra, Sarva Marga Anusari, it enters all over the body through srotases. Balya, Purnarnavakari. Okay. Sharir Indre Chetasam. So it gives strength, and Purnarnavakari. It makes our body and indriyas like punarjanana. It will make it work excellently. Okay, so that is Shamana Sneha. Now we will see Shamana Sneha Kalam. When should be given? Pibet Shamana Sneham Annakale Prakankshitaha. Then Kshamanaha Kshudvato Ananno Madhyama Matrascha Sasyate. Okay, Annakale Prakankshitaha, which is very, very important. The person should have excellent appetite. Okay, and it should be Madhyama Matra, and it is Ananna, in the empty stomach. Okay, when the person is having excellent appetite, when he is on empty stomach, okay, and it should be in the form of Madhyama Matra according to Vagbhata. But as I told before, for Shamana, it is always go for Uttama Matra, because how much is the dose, that much dosha Shamana can happen. Okay, so for Shamana purpose, so accordingly, it should be administered as I mentioned. Okay. So what happens? Basically, if it is administered without hunger, that is without good appetite, it will not act as Shamana Sneha. Because in Abubhikshita person, the channels or the srotasas are covered by Kapha, and the Sneha Dravya cannot pervade Sarva Sharira due to Kapha Avrita Srotas. Okay. So if in the above Abubhikshita person, there will be Kapha Avrita Srotas. Okay. In the Kaphavarta, when Kaphavarta Srotas, the Gritam cannot penetrate to all over the body. And the unpervaded Sneha cannot do Dosha Shamaka, which is the main purpose of Shamana Sneha. That's why it should be given only in the empty stomach. So the channel should be very clear. Avarna Rahita, Kapha Avarna Rahita. So in Abubhikshita person, if the person don't develop the appetite, his channels are covered by Kapha Dosha. So if you give Shamana Sneha, it will not go to head to toe. Then how dosha shamana is possible? So that is the reason why it should be given in the empty stomach. Okay. So it is best for rejuvenator, and it does very beautiful dosha shamana, and only Acha Sneha is used. Okay. You can see many of us, don't, we forget, whenever you give, even for Shamana Sneha, okay, basically you must use it as, okay. Am I audible? Yeah, okay. So if you see Patya, so Patya should be very important. Okay. Atracha Uttamaya Matrya Snehapana Anantaram Patyam Karyam Arnodatta. So after the intake of Shamana Sneha, the patient is advised to follow Patya. What kind of Patya? Upacharastu Shamane Karyaha Sneha Viriktavat. Okay. Basically, you see what you do on the day of Virechana. Same must be followed. You can see even after if you are giving Shamana Sneha also. So nowadays you can understand with this with these explanations. What we give 10 ml, 15 ml, 20 ml and all. It is like maybe they can act as a Brahmana Sneha only. They may not act as a Shamana Sneha, because if it is very less amount of dose, then that will act as a Brahmana. So basically, we should ask our question whether we are really practicing Shamana Sneha. It's a question mark, because when you are giving Shamana Sneha, it should be Uttama Matra, because Uttama Matra should digest in 24 hours, basically. Okay. Then after digestion, Upacharastu Shamane Karyaha Sneha Vriktavad. Basically, Patya must be followed. Atra Uttamame Matra Snehapana Antaram Patyam Karya. So do's and don'ts of Shamana Sneha is similar to that of Virechana. That is, very light food must be given to the patient, or he must be advised to fast. If the digestion is not happened, if you feel that given Snehana is not digested properly, then don't ask him to eat anything. Let him stay, let him do fast and give food until, and don't give food until he develops proper appetite. Okay. Then further explanation is given by our acharyas. Deya yusho rasova syat akrita kritova alpa alpa sarpishkova vilepiva vidiyate. So this is either you give yusham once it is digested. This is very important. After digestion, once the Shamana Sneha is digested, then you can give yusham, mamsarasam, depends on the person's taste, kritam or kritam akritam, that is samskaritam or seasoned, seasoning, either seasoned or unseasoned yusham or mamsarasam, alpa alpa sarpishko vilopiva. So you can give vilepi also, vilepi virladrava. We can give vilepi also with added with little bit sarpi. Okay, this is the patya. Next we will see Krishna Sneha or Brahmana Sneha. Brahmano Rasamadhyadehi Sa Bhakto Alpaha. You see here the word Alpa is mentioned. So that's what I mentioned. If you give 10 ml, 15 ml or 20 ml, it is like Alpaha. It becomes like Alpa dose, very mild dose. So people nowadays practice like giving 10 ml, 15 ml. I'm not blaming, but you can just see, where the difference is. Okay. So if you give, like, if the dose is very less, if it is alpam, then how you can say it is a Shamana Sneham? Then it will become like a Brahmana Sneham. Okay, of course, in Vata Vikara, if you give Brahmana Snehanam also, Vata Shamana can happen. Indirectly, you can say like that, because, Dhatu Kshayam can be taken care of by Brahmana. But what about other doshas? Okay, so Brahmano Rasamadhyadehi Sa Bhakto Alpaha Hitaha Sacha Bala. Where you can give, for whom you can give, Bala, Vriddha, Pipasartha, Snehadvisha, Madhyashilishu. Okay, then Tatra, Durbala, Mandagni, Bala Vritta, Sukatmaihi. Okay, so then Apatya Rikta Koshta, Jwara Atisara, Kasibihi. So in these people, you should give Brahmana Sneha, which is Alpa quantity, and always with food. Sa Bhakto Alpaha. Sa Bhakto Alpaha. Okay, it should be less and less quantity. Okay. Kriswa Peya Sukha Sahi Parihare Na Vardate. Okay. When should be given? Prag, Madhya, Uttara Bhakto. It can be given just before food, during food, and after food. Okay. So if it is given before food, that you gave the alpha dose, then ask the person to intake food, then it is good for the diseases which affects below the hips. Suppose if you are asking the person to take in between the meals, it takes care of the diseases which affects between the head and the hips. Okay. Then third, if you give this after food, okay, then it takes care of the disease which affects the head. Okay, it takes care of the head which affects the head. So Brahmana Snehana can be given like before food, during food, and after food. Okay. Next, we will see Uttarabhaktika Sneham. So this is a very beautiful one, especially if someone want to, you can see this when you go through the text. Okay, when you go through the text, there are for certain diseases, certain kind of things are mentioned. Okay. So basically, if you see Bahu Srisha Gate Nasyam Panam, okay, Cha Uttarabhaktikam. So if you see Bahu Gata Rogas and Srisha Gata Rogas, okay, in these two, definitely, if they are saying something specific, it should be always given. Okay, Nasyam and Uttarabhaktikam is always best for Bahu Srisha Gata. So take the example in Pakshagatam or Arditam or Vishwachi or Apabahukam. Okay, any kind of diseases with brain related things or sinusitis or eyes or like face related things, please, my dear friends, start practicing this Nasyam and Uttarabhaktika Snehapana and just see the results. Okay, so basically, if our acharyas are explaining something very specific, that is the best you should understand among all other therapies. So for Bahu Srishagata, go for Uttarabhaktika. Definitely not go for one. Must administer Nasyam and Uttarabhaktika Snehapana, which is the best. Okay. Basically, Uttarabhaktika Snehana is indicated in Urdu Jatrukara Vikaras and useful in the disorders of Dhyanavata and Uttanavata. Once again, this is also very beautiful. If you come across any diseases due to Dhyanavata and Uttanavata, the Snehana, you please go for this Uttarabhaktika Snehapana. So the Snehana which is given after food is known as Uttarabhaktika Snehana. Uttarabhaktika Snehana is administered in the form of Brahmana Sneha. Okay. Okay, if you see Chakrapanis, Nasye Panecha Uttarabhaktikam, Masha Shaindava Sadita Meva Tailam Nyayam. Okay, if you see Chakrapani beautifully explains, one special preparation, Masha Shaindava Tailam. Okay, so in Apabahuka, especially in Apabahuka condition, Masha Saindava Sadham. So Tatra Masha Kwataha Saindavasya Kalkaha. Only these two. Okay. Nasya Panacha Uttarabhaktikam, Masha Saindava Sadhita Meva, Tailam, Nyayam. So especially when in the context of Apabahukam, this the oil which is prepared out of Masha and Saindava Kalka should be given to patients. Excuse me, Vidya, Vignesh sir கூப்பிடுறாரு. Sorry, excuse me. So this is for Apabahuk. Okay. Then we'll see now Shodhananga Snehapana. Okay. Prakupita dosha Shodhanartham Ubinjamana Snehaha. Okay. So Prakupita dosha Shodhanartham Ubinjamana Snehaha. Okay, so even dosha se samanartham ubhenjamana snoha, prakipita dosha shodhanartham ubhenjamana sneha, these two are my lines. It is not available in any text. Okay, so please bear with me. So prakipita dosha shodhanartham ubhenjamana sneha, that is shodhananga snehapana. So when to give shuddhyartham punar ahare naishe jirne piben naraha, Charaka Sutram 13-16. Then Histane jirne eva anne Sneho Achaha Shuddhe Bahu. Ashtangradim Sutram 16/19. Okay. So Shuddhyartham Punar Ahare Nishe Jirne Pibenara. So it should be given in the early morning, immediately after the digestion of previous day food. So 3 criteria. It should be given in the early morning, after the digestion of previous day night administered food, and before developing appetite. Okay. So the patient should not develop appetite. So these are the three criteria. The patient should not develop the appetite. Second, immediately after the digestion of previous night given meal. And the third criteria is in the early morning. So when you follow this criteria, definitely the dosha shodhana will happen. And proper dose. Yes, and proper dose. Okay. So the Shodhana Purvaka Snehapana is usually administered immediately after the digestion of previous day food and before getting hungry. Okay. Then Hemadri opines that if it is taken when the person is hungry due to Agni Bala, that is Agni Bala is Uttama when the person is hungry, the entire quantity will be digested. Okay. So when the Agni Bala is excellent, when you give the dose, it will be digested. The purpose of Shodhananga Snehapana is to excite dosha, that is dosha utkleshana. Okay. And dosha utkleshana do not occur in Uttama Agni state. That is the reason why it should be administered when the previous day food is digested, but before the appetite is developed. So basically, when you basically for Shodhana purpose, dosha utkleshana should be done. If the person develop appetites, that the given dose will be digested, so it will act as a Shamana Sneha, it will not act as a Shodhana Sneha, because if the appetite is very good, the given dose will be digested, whereas it should not digest immediately, it should take time. So dosha utkleshana should be achieved only if you give without the person is not having the appetite. Okay, so Snehana is administered to achieve the desired dosha utkleshana within specific number of days. The minimum and maximum number of days of Shodhananga Snehapana is 3 to 7 days respectively. Then if you see the Acharya Boja opines that a person having Kabaja, Pittaja, Dvadaja Prakriti needs 3 days, 5 days and 7 days of Snehapana respectively. So Shodhananga Sneha should be administered in such a dose as per the Koshta that it should bring about Samyak Snigdha Lakshanas as well as dosha utkleshana within 3 days, 5 days or 7 days. Okay. So if you see in Shamana Sneha, the dose is always larger. As I said, it should be administered till dosha Shamana. It is not mentioned in anywhere. Okay. In case of Brahmana Sneha, the dose is always smaller and it is administered till the Brahmana effect is achieved. Samyak Brahmita Lakshanas. So if you get that, stop it. Okay. So it may take 15 days or months also. Then if we see, next we will see Arohana Shodhananga Snehapana. Okay. The word Arohana means rising or ascending. Okay. Classical reference for Arohana Shodhananga Snehapana. If you see, there is no clear direct evidence or classical reference of Arohana Karma for Shodhananga Snehapana. But there is an indirect reference in Arunadatta commentary under Ashtanga Hridaya, Sutrasthana, 16th and 17th chapter, 16th chapter, 17th and 18th sloka. And if you see, this interpretation is my personal opinion on which others may or may not agree. So if you see this particular sloka, you just go through it, how beautiful it is. Ajnata koshte purusha uttama matra vishaye purvam hirsiyasim kalpayet tato madhyamam tata uttamam cha prakalpayet evam madhyama matra vishaye hirsiyasim risva matra vishaye api hirsiyasim prakalpayet ajnata koshte hi bahu kuryat jivita samshayam. Okay, if you see, basically if you just go through superficially, the sloka's meaning is like that. Before S.J.A.C, okay, like before Hrisva Matra, test dose you give. If you are giving Madhyama Matra, always just test dose you give, then go for Madhyama Matra. And even in Uttama Matra also, first give S.J.A.C, then go for Uttama Matra. This is simply, when you go through in the superficially, this is the, translation you get. That means to say, test dose should be given before Hrisva Matra, before Madhyama Matra, and before administering Uttama Matra. Simple. But if you see, if you want to interpret, you can see here in this sloka, the word tato is mentioned. So tato, the word tato can be interpreted as similar to that or afterwards or followed by. You see this? So the word tato can be interpreted as similar to that or afterwards or followed by. Okay. So the word tataha is also mentioned in the sloka. The literal meaning of tataha is moreover, furthermore, or in addition to. So the following narration can be translated as, initially the physician must administer test dose followed by Hrisva Matra, then Madhyama Matra, and then Uttama Matra Snehapana. So you can see, we can consider this is like Arohan Sneha. Like because Hrisva Matra first you are giving, sorry, S.J.A.C first you are giving, then Hrisva you are giving, then Madhyama you are giving, then Uttama you are giving. You can see like, ascending. Slowly the dose is increasing, right? So we can consider this as a example, or sorry, we can consider this one as a basically reference. Okay, that's what I felt. Okay, because directly we cannot go for high dose because the high dose can kill the patient because Ajnada Kostehi Bahukurya Jivita Samsen. Uttama Matra cannot be given without knowing the Kosta. Directly, you cannot administer the high dose immediately because it can kill the person. So, it is always better to go slowly. S.J.A.C, Hrisva, Madhya, Uttama. This is the interpretation because Acharya has clearly told suddenly you cannot give the high dose. So, basically, go with slow. Start with slow. So that we can say it as a Arohana Snehana example. Okay, all right. So now, if you see, next is how we should administer this. Okay, but before this slide, I'm not able to retrieve it. Basically, if you see the clear-cut evidence of Arohana Snehapana is mentioned by Kalyana Karaka. Okay, it is in the 17th century book where Kalyana Karaka is the first person to explain about this Arohana Snehana Karma, Arohana Shrodhananga Snehapana. And if you see, even in Mangasena, one indirect reference is that. So during the Balataka Snehana administration, he says Balataka Snehana cannot be administered just like that in Uttama dose. He says like, first day, second day, third day, Uttama dose, Madhyama dose, and Hrisva dose. First day how much should be given, second day how much should be given, third day how much should be given until the 7th day. And then Madhyama Matra also first day how much, 7th day how much. Then Hrisva Matra also first day how much, 7th day how much. So in the context of Balataka Snehana, Mangasena explains. So that is also we can consider here for all the Snehapanas, whereas this Arohana Krama is clearly explained by Kalyana Karaka. Okay, in the 17th century book, he is the one person who explained this very clearly. Then followed by our Kasture Saab. Okay, he wrote in his book very, very clearly about this Arohana Snehapana. Okay, so how we will administer? So Shodhananga Snehapana is consist of Purva Karma, Pradhana Karma, and Paschat Karma. Okay, so basically, before giving Shodhananga Snehapana, basically Agni must be assessed. Okay, then how you will assess the Agni? You know that Ahara Charana Shakti and Abhyavana Shakti must be assessed before commenting Snehapana. Okay, then basically, see, it is very, very important. If this one must follow, very important to get the result. If the patient is having Bahusleshma or is Tula, or if he suffer from Vishamagni, before administering Snehapana to him, use of Ruksha Dravya, Ruksha Purukka Snehapana is. Okay. So basically, Snehapana should be administered after Rukshana Karma. Okay. So Snehana Puruka Rukshakarma. Sorry, Snehana Puruka Rukshakarma. It should be done. Then only you should go for Snehapana. Otherwise, you should not. Okay. So Bahusleshma and Stula, because Stula Snehapana is contraindicated. You know that. Okay. So and Bahusleshma also. Shodhananga Snehapana, Shodhana is contraindicated. So in those people, you must do Vishamagni in this criteria. Three people. So Ruksha Dravyas, do Rukshana. Okay, which has Lagu, Kara, Tekshana, and Ushna Gunas and possesses Kashaya Kadu Tikta Rasas is advised, like Ingochadi Churnam. Okay, in order to get Samyak Snigdha Lakshanas or Udvartanam, all those external treatments also. Internally and externally, do Ruksha Chikitsa. Okay, then followed by Snehapana. Then only you should get, then only you will get, okay, the Samyak Snigdha Lakshanas. Okay, and if you see, especially if it is too much Vata dosha is there, then what you do is Vasti is explained. Okay, especially Snehapasti or Matravasti. So these are the two criteria. If it is too much Kapha, go for Ruksha. If it is too much Vata, go for Matravasti or Anuvasanavasti, 5 to 7 days. Then go for, Snehapana. After, give gap, then go for, because immediately after Vasti, Snehapana should not give in. So give some days, Visramakala, then start Snehapana, you will get good results. Okay. Then if you see, basically how to do, it is very, very important. This is SOP I made. So Krura Costa person, understand Krura Costa person. So you can ask this question. Sometimes you will pass tools after straining. You need to go and strain. Then regular bowel movements will not be there. Okay, he will pass tools 1, 2, or hardly any water content will be seen in the stools. Okay, if you see soft bowel, it's a pickup run posta. Okay, then most of the days they will have bowel movement twice a day. Rarely they will have solid stools. They don't have to strain for the normal bowel movement. Then Costa, if you see solid banana stools, maximum once daily. No strain or bit strain is necessary to pass stools. Okay, that is how you ask the question. Okay, then definitely Pachana and we usually say Deepana Pachana. Sorry, it is not Deepana. It should be Pachana Deepana. If you see clearly Shruta and Dalhana commentary, he says only about Pachana. He never talks about Deepana because Pachana itself takes care of Deepana basically. Okay. So he says about, Pachana only. He doesn't talk about Deepana because Pachana alone will take care of, Deepana. Okay. Basically, it should be done 3 to 7 days. Okay, basically, how you will know you have Pachana. So Samyak Langana Chikita, Samyak Langana Lakshanas, you can consider it is as a Samyak Pachana Chikitsa because Pachanam is Langana only. So Samyak Langita Lakshanas, you can consider it as Samyak Pachana Lakshanas. Okay, why you should give? Because Snehas Utasasya Uttejanam post lago karicha. Okay, Ajirna Glani and the Acha Pijade. So basically, to make the costa to improve the Agni, okay, to improve, to have a proper bowel movement and to prevent Ajirna and to relieve constipation. That's why you should give this increase the Agni, okay, Sneha Mona Panapuram, Datavyam, Mrudubesham, Uttasa Ujjayanam. So Pachana Deepna should be given to increase the Agni, to digest the Prasana and constipation. So mode of action, if you see, Deepna Dravya stimulates the vagus and and also stimulates fundus and pylorus of the stomach. These phenomena stimulate the Agni and enhance the Ama Pachana. Okay, the Deepana Dravyas, due to their bitter and pungent taste, promotes gastric juice and facilitate digestion. These drugs sensitize the oral taste, thus facilitating saliva secretion. They also induce gastric secretion and hormone which stimulates the HCl production. That's what does this the Pachana Deepana drugs. Okay. So in Samyak Langana Lakshanas can be taken into consideration for Samyak Pachana Lakshanas, like bit more pollution, Visargam, Gatra Lagam, Hit Kanta Udgara Shuddhi, and Ruchi. Okay, so if you see any of the symptom, 1 or 2 or 3 are all together, then you can stop the Pachana Chikitsa. Okay. So practically, the Pachana Chikitsa is continued or administered for 6 to 7 days for a better outcome of the Snehapana. Since it is an Apatarpana Chikitsa, most of the patient may not be able to tolerate this procedure for longer duration. So Pachana Chikitsa should be stopped immediately once the patient develops proper Nirama and Langana symptoms. Okay. Then diet before Snehapana is very, very important. Bojo Annam Matraya. Okay. Then very proper quantity, very simple quantity, very light diet. Okay. Piban Pitavanabi, the person who is going to take Snehapana, even the person who had already taken the Snehapana, definitely follow the diet. Okay, Dravam, Ushnam, Anabhishyanti. Okay, Adi na Ati Snigdam, Asankaram. It should not be mixed with so many foods. So Asankaram. It should not be mixed with so many foods. It should be Drava, Ushna in nature, and Anabhishyanti. Okay. So this is about diet before Snehapana. Then what type of Snehana should be used? Sneham, Pakkam, Apakkam va Payitva Chikitsakaha. So Vangasanam, you can see, okay, Yata Dosham, Yata Kalam, Yata Yati, Yata Balam. According to dosha, kala, vyadi, and sneham, pakvam, apakkam va, payitva, chikisaka, either processed or unprocessed. He is very strict. You know, he wrote that, you know, anything you use, processed or unprocessed. Vangasan, okay? So either or processed or unprocessed fat should be administered to the patient after due consideration of disease strength, etc. Okay? Then, okay, you know this. Already I have told when vata is vitiated, ghee mixed with all those things. Okay. Then if you see Gritapana in Prameha, this is very, very important. Okay. So if you see Guda Anupa Amisha Kshira Tila Mashu Suradari Kushta Sofa Prameheshu Snehartam Na Prakalpayet. So if you are treating Kushta, Sofa and Prameha, you should not use these things. Are the snehana which is processed with these things? Amisham, Chiram, Tilam, Masham, Sura, Dati, Gura. In the food form also you should avoid them. Okay? Or the Gritam or Thailam which has any one of this ingredient also should not be used in Pushta, Sofa and Prameha. Okay? Very important. Then test dose. Okay, usually 3 matra 25 to 30 ml is considered to be test dose in day-to-day practice. Okay. Then if you see assessment of Agni and Costa prior to first day of Snehapana, I thank my dear friend Dr. Vasant C. Patil. It is his formula, so this everybody can safely follow. It is easy to fix the dose. So test dose of the first day into time taken for digestion divided by given dose. So when you do this, automatically you will get the next dose. Okay. So SOP for Snehapana. So before initiating the Snehapana, always ensure that emergency medicaments are readily available. In emergency situation, it may not be possible to get the required drugs, etc. on time. Further, Anupana Dravyas, Nikshna Jala, Yusha, etc. should be ready. Do proper Rukshana Kriya before Snehapana. It is always beneficial in many ailments, especially where Rukshana should be done. Okay, evaluate lipid profile before and after the procedure of Snehapana. Next, make sure that the patient doesn't develop appetite before Shodhananga Snehapana. Then continue the procedure till Samyak Snigdha Lakshanas are observed. Always take the detailed history of the patient. Okay, his surgeries, illness, etc. Always check his vitals every day. Ask for dairy allergy because some people are allergic to ghee products. It is better to avoid ghee on those patients and either go for Thailam. For Swastha, or if his cleansing is part of seasonal routine, then pure cow's ghee can be used. Even just use pure cow's ghee for Shodhananga Snehapana purpose. Okay. So this is no observation. I have observed that medicated ghee gives better results than the pure cow's ghee. Intake of too much saturated fat, because pure cow's ghee is intake of too much saturated fat, is also not advisable. Pure ghee is saturated fat. Samskaro gunantaranam. Samskara will help with herbs, may cause some internal constituent of ghee to change. Thus, it makes the ghee highly versatile and safe for Snehapana. So, I always go with Samskarita Kritam. I told why I always follow this. This is the answer. Okay. Then advice to the patient. Advise the patient not to use cold water during Snehapana, and only hot water must be used for everything, including bath, washing, everything. Hot water is to be used even toilet purpose. Okay. Then patients not to control natural urges. Next is exercise, traveling, extreme climate, all must be avoided. Okay. Next, only after developing proper appetite, the patient needs to take food. In between, snacking must be avoided at any cost. Patient must maintain celibacy and should be advised not to sleep during daytime. These are all very important. Okay. And if you see, one day before the actual administration of Snehapana internally, the concerned patient should be given food in moderate quantity. The food should be liquid, hot, and anabhishyanta, and should not cause obstruction to the channels. Okay. Then, if you see, it should not contain snigdha dravyas and it must be avruddha virya. Okay. Then if you see, the patient must be instructed not to consume food too quickly or too slowly, and he must be advised to take food which is favorable and conducive to his body constitution. That is satmya ahara. Many times we don't ask this question to the patient. Ask him what he like, and because Snehapana creates always aversion. So basically, give him the simple foods which he like and process it with that. Okay. So Snehapana may cause complaints like Agni-mandya, Arochaka, Shula, Brahma, Parisheka, Shirashula, etc. in some patients. Drugs which are helpful in these symptoms must be kept ready. Okay. So these are things I have written. You would be knowing all this, medicines, what to give. Okay. Then if you see, these are the materials required. Okay. Medicated ghee, measuring glass, glass dove, silver vessel, knee chair, cotton. Okay. Then if you see soft cloth, okay, for blindfolding the eyes of the patient, it is always better. Don't allow the patient to see the ghritam. Just, always cover his eyes, okay, and ask the patient to cover his nose also. Then you give Snehana, because always this taste and smell and seeing, just see this third day, fourth day or fifth day and all, just by seeing the ghritam, they will get aversion. So always close his eyes, ask him to close the nose, then you give Snehapana, it is always better, easy, okay? Then Panakalina Lakshana, you see, Prilasa, Chardi, Aruchi, Trishna, and Udgara, okay? And the patient may also feel the fullness of abdomen, okay? So these Lakshanas are produced due to the aversion towards the smell, taste of Snehana. Fat digestion can also, why he feels like that? The fat digestion can also cause these symptoms. To overcome these, lemon juice, liquid mandam, hot water, bhavana shunti can be given in the middle of Snehapana procedure. So if somebody has these symptoms during Panakalina, during the Snehapana, if he has these symptoms, give these ingredients, give these dravyas, then he or she will feel better. Okay. Then Jiryamana Lakshana, Shiroruja, Brahma, Nishtiva, all those things. Okay. So if you see this possible reason for Jiryamana Lakshana, you can see like nausea. If it's so little bit, I will, because it's a very big topic. I think I covered little bit about how to give another thing. Here I tried to assess what is the possible reasons for everything. So if you see possible reasons for Jiryamana Lakshana, first one is nausea. Why the person developed nausea when he had taken the Snehapana? So the high fat intake irritates the stomach, and the stomach irritation stimulates the vomiting centers of the brain, which causes nausea, which could be the reason. And the abnormal smell of Snehadravya also could cause nausea. Okay. Then if you put, somebody asked me this question regarding, depends on the Avastha Paka, how you can, how you can explain about the Sneha digestion. If you see, this is the answer. If you put insight in Avastha Paka, the production of kapha takes place in the first phase of Avastha Paka, which might be the reason why the person feels Lala Srava after taking Snehapana. Why he develops Lala Srava? That is in the first phase of Avastha Paka, kapha dosha is produced. That's why. Okay. Then headache. Why he develops headache? So stomach irritation by Snehapana can cause headache as well as rasakshaya, because not eating so much. Okay, rasakshaya and dehydration. Rasakshaya, you can always say dehydration, which is usually observed during Snehapana, is the main reason for Shiro Ruja. Okay. Then if you see Daha, why person develops Daha? Burning sensation in the stomach. Daha here, don't think, basically we need to read in between the line. Daha means it is internal Daha, not external Daha. Burning sensation in the stomach, sore belching occurs due to the gastric irritation and excessive gastric secretions. Okay. Then if you see Sadam and Klamam, So excessive quantity of fat in the stomach cause more blood flow to the stomach area to digest the fat, and the brain may not be able to get enough oxygen supply. Lack of food and nutrition during Snehapana could also be the reason why the person feels weak, tired, and fatigue. Okay, then Shabda Dvesha, aversion towards sound occurs due to Rasadhatu Kshayam during Snehapana. Then if you see Trishna, Mukha Murcha, and Tama, so if you see this and all happens, Adhisnigdha Lakshanas we see. So when we eat a normal diet, the carbs are converted into glycogen, which the body uses for energy. So every gram of glycogen stores approximately 3 grams of water, and during Snehapana, the body is in fat burning mode and very little amount of carbs are available to the body, making the person feel thirsty and dry mouth. When we are on a normal diet, insulin level spikes after having food, and the spiked insulin trigger the kidneys to hold water. During Snehapana, due to restricted diet, insulin level drop and kidneys release this stored sodium and water. The water that exits from the body leads to dehydration symptoms like giddiness, dry mouth, and thirsty feeling. Okay, so I have extensively put all these ideas in my book. So I tried to analyze what could be the reason for Samyak Snigdha Lakshanas, Atisnigdha Lakshanas, Jiryamana Lakshanas, Asnigdha Lakshanas, and everything. So go through in my, I'll see these slides. Okay. So if you see the symptoms of proper digestion, proper normal amount of flatus. Okay. Then diet after Snehapana, if you see, Bhojyo Annam Matraya, Suhabhavi Pitavanabi, Dravam, Ushnam, Anabhishyandi, Asnigdam, Asangaram. This is already I told. Okay. So termination of course, when to terminate. So the Snehapana is continued with an increasing dose in Shodhananga Snehapana. Okay. So basically, when the person develops proper appetite, Samyak Snigdha Lakshanas. So basically, you can give 3 criteria, because some people always try to terminate the Snehapana when they see the Adastat Sneha Darshanam. But basically, it is not enough, because take example, when you give Sukumaram Kratam, it contained castor oil. Basically, in 3 days itself, you will see the Adastat Sneha Darshanam. So basically, that alone cannot be considered as Samyak Snigdha Lakshanas. Okay, then basically you should see this all the other symptoms. Okay, the person should have best appetite. Okay, then Adastat Sneha Darshanam, then Snigdha Varchas. Okay, all those things you should consider for Samyak Snigdha Lakshanas, not only this Adastat Sneha Lakshanam. Okay.
Sir, your voice is not audible.
Just a second, sir. It is struck, sir, a little bit.
No problem.
Yes. So if you see, I have written about possible, okay, assessment of Samyak Snigdha Lakshanas. Okay, Vatanalomyam. Okay, if you see belching and burping with the smell of Snehadravya frequently, along with the heaviness of the abdomen, or if you see how you can assess Vatanalomyam. Okay, so this is the practical guide I developed. Assessment of Samyak Snigdha Lakshanas. Okay, practically. So for Vatanalomnam, I gave 3 criteria. Then if you see Gatra Mardavam and Tok Snigdhata, I gave 3 criteria. Then Asamhata Varchas, I gave 3 criteria. Then Snigdha Varchas, I gave 3 criteria. And Gatra Lagavam, I gave 3 criteria. And Snehodgamam, I gave 3 criteria. So if you need to study this and give the scoring pattern after asking the patient. So if the scoring pattern is 10 to 30, Samyak Snigdha Lakshana, you can. Then if the score is 14 to, then you can say Madhyamak Samyak Snigdha Lakshana. Then if the scoring is 17 to 21, you can say Pravara Samyak Snigdha Lakshana. So this, I developed this tool, which is very important, which is very easy. You can patient and you can just make a tick and you can make one nice in the paper. You can make these criteria and ask the questions simply. And if you come across this scoring pattern, easily you can understand whether it is Avara Samyak Snigdha Lakshana or Madhyama Samyak Snigdha Lakshana or Pravara Samyak Snigdha Lakshana. It is available in my book. You can go through it. Okay. Then I have a possible reason why Vada Nalomana happens, why Agni Deepti happen. All those things also I have written. Why Klamam, Glani, Halagom, Kale, Shariradhi, Meda, Druti. Okay. Then Adhisnigdha Lakshana, why it happens. Okay. All those things I have written. You can read. Okay. Then why Swasakata. Okay. Then okay. If it is Snehapana Patya, I already told. Okay. So the patient, when Snehana is digested, should be given bath with hot water and then served with warm gruel as desired. Having, you see, as desired, it is very important what he likes within our parameters. Should be, don't give him something which he don't like or she don't like, then you cannot give proper Snehapana. He will say I don't drink. Okay. So having well cooked little rice or fragrant soup or meat juice devoid of fat or processed and having very little ghee or vilepi. He should abstain from taking any food before the appetite or hunger. Rukshana and Abhishandya aharas must be avoided. Okay. So once again, I said about Adhasthat Sneha Darshanam, then Purusha, Purusha Snigdhata, why it happens. I have written that also. Okay. Yusha can be prepared with Kulatta, Adakam and Mudga lentils. Okay, it is lentil soup. Vilepi can be prepared with Shastika rice. Can also be given depending on the dosha and bala of the patient. Okay. Then, with this, I will stop about my presentation, because once again, there are plenty to cover. Since the given time is 1 hour, I have crossed more than 1 hour. So hope I covered certain important points. Hope you got some kind of ideas or some kind of little bit knowledge presentation. I hope you enjoyed my presentation. If you have any questions, I will try to answer within my little knowledge. So I thank the organizer and VAP for giving me this opportunity, and special thanks to my friend who asked to do this. So I thank all the gurus, acharyas, and my humble pranam to everyone. Thank you. Thank you so much.
Thank you, sir. Such a wonderful session and your expert opinion on the this topic, Abhyantara Snehapana. If someone has question, can post their question in the chat box or can raise their hand, so you can directly speak to the sir. Yes, Dr. Ravi Kumar Moria, you can ask your question.
सर उत्तर भस्तिक स्नेह के बारे में जानकारी दे दीजिए, डोज और कौन सा घी यूज करना है.
Pardon?
Hello.
Sir, can you repeat the question?
So will you explore Uttar Bhautik Sneha, which Gritapan should be used in which quantity? Uttar Bhautik Sneha.
See, Uttar Bhaktika Snehapana, usually I go for, for Apabhavaka. Since it is more Vata, then I go this Mahamasha Tailam, okay, or Masha Saindavadi Tailam, okay, then Karpas Tailam I give, okay, in Pakshagada Mandal, I go for Kalyanakam Gritam along with Dhanvantara Gritam, or I go for Vidaryani Gritam, okay, and basically Uttar Bhaktika kind of Brahmana Sneha, Okay, and after the digestion of food, small amount is given, or sometimes I mix it with simple 2 teaspoons. I give repeatedly, like every 2 hours, because at a stretch patient may not like it. So 1 or 2 teaspoons I add, then I give a little bit, like maybe like half a glass. Then after 2-3 hours, on dose, in 3 to 4 doses I give.
Okay, thank you, sir.
Sir, there are some question in chat box, so you can give direct answer.
Yeah, there is one question. Snehana like Mahatikta Girta, then Gugulatiktakam, Patavladi, Shodhananga Snehapana. We observe samana symptoms like Kandu, even if the dose is Shodhananga Snehapana. Is this advisable to use such yogas in Shodhananga Snehana? Only Murchita Girta or Taila is advisable. See, especially that's what I said when it comes to Kushta. If there is some kind of dosha shamana, very little will happen. That is okay. That is absolutely not the complete symptom should go. Shamana sneha purpose is completely symptom should. This is during this amount of what amount of symptoms reduction you get. It's not like completely the disease is reversed. A little bit shamana. So that is in the dose, definitely because of the proper dose, those utklesh occurs. You see in the several Samyak Nigdalanas do occur. So nothing to worry. You see when you end up the in psoriasis, other skin diseases, that if you okay, so even simply by giving this processed ghritam like Google Tiktakam and other things, you get the better results than that of Murchita ghritam or Murchita Tilatailam. Okay.
Yes, sir. There
Yeah.
are some question in chat box.
Yeah. So any examples of Vicharna Sneham? Vicharna is a kind of Brahmana only. Okay. So basically I give it for in the pure Vata Pakshagatam or in Ardhitam. Okay, in some kind of skin diseases also, where the people, those who are not fit for Shodhana in such cases, and in the young children. Okay, so always the simple ghritam, little quantity mixed with food is I always give, but as I said, I don't give a taste stretch because because of complications. I give like 1 spoon, teaspoon, like every 2 hours, 3 hours, like that. Yes, it is said to have dosha utkleshana during Shodhananga Snehapana. I told, this answer I already told. When you give samskarita ghritam, little bit dosha shramana does happen. But if you give proper dose and if you for proper time like 5 days, 6 days or 7 days, definitely you will see the samyak snigdha lakshanas, because samyak snigdha lakshanas are nothing but the dosha utkleshana symptoms. Okay, so basically you do achieve dosha utkleshana symptoms. As I said, dose and time plays a very important role in dosha shamana and dosha utkleshana, because we are going to give in the early morning without digestion of previous day, food. Then in the 2 criteria and proper dose, 3 criteria, if you give the ghritam or tailam, definitely the dosha utkleshana will occur. It is Shodhana Purvaka Snehapana, because we the snehana during that time, that I always tell, when you give, how you are giving plays an important role, whether the Dravya as dosha shamana or dosha shodhana. You think about Aushadha Kalam. Why they mentioned Aushadha Kalam? Aushadha might be the same, right? The Aushadha might be the same. But when you give according to the Aushadha Kala, it acts differently, right? So same is here. The Aushadha, the Ghritam may be same, but when you are administering, the time plays a very important, quantity plays a very important. So when you give that time, that achieves the dosha utkleshana. Very simple.
There are someone want to ask, Dr. Ravindra want to ask some question.
One more thing, sir, suggest Shamana Snehapana and skin disease, sir. This is a very big question. Depends on the doshas, because you know there are plenty of gritams available for Shamana Sneha or Shodhananga Sneha for skin diseases. I cannot simply say, basically one example I'll tell you what is the difference where you give Mahatiktakam and Tiktakam. If you see the ingredients of Mahatiktakam, it is little bit more Shodhana in nature, whereas if you see simple Tiktakam, it is more Shamana in nature. Okay, so where you need little bit Shodhana of doshas, go for Mahatiktakam, whereas if you feel that, you know, the Shodhana is done where dosha Shamaka should happen, then go for, this Tiktakam. So this is one example I'm giving. So depends on the dosha, depends on the ingredients, you go through it. Whereas you say the example, Vata Kapha condition, go for Google Tiktakam. So like that, you should see the ingredients and the doshas, dosha hara of that particular Gritam. Then accordingly, you can choose for skin diseases. Okay.
Hello.
Yes,
Hello.
sir.
I'm Dr. Ravindra. Am I audible?
Yes, audible, please tell me.
Okay. Sir, in the case of Shodhananga Snehapana, so first day we give S.J.A.C Snehapana, right? So let's take, we have given 30 ml of Snehapana and the patient digests it.
First day we cannot calculate. First day is S.J.A.C leave, that is a test dose.
That's
Okay,
what
you
I'm
should,
telling.
yeah,
And the
you
first
should
day we
never
have given test
calculate.
dose.
Yeah, you should
And the first day
never
we have given
calculate.
test dose.
Yes, then next day only you should start first one of
I'm coming to that one. I'm coming to that only. So let's say the Sneha gets digested in 3 hours. Well, we have given 30 ml of Snehapana as S.J.A.C. What will be the dose to be fixed on the next day? On what basis?
You calculate, you know, how much needed in 24 hours. Then you calculate for 7. Suppose if it is 3 hours, you know, in my book, I have written 3 types. Okay, how to calculate. Suppose if it is digested in 6 hours, then.
Hello.
Yeah. In between I got the noise. So basically in the first day, if it is 30 ml digested in 3 hours, then you calculate for 24 hours how much quantity is needed. Okay. So that should be the 7th day quantity.
On what basis?
Because 7th day,
this is done, sir?
in 7th day we assume that the 7th day is the maximum dose and 7th day is the last day. So we assume that 7th day we need to give the Snehana which digest in 24 hours, right? So
but
that is the
becomes Uttama Matra, which is against Charaka's this thing. In Charaka, it says it is Madhyama Matra for Shodhana.
Yeah, that's what,
in 12 hours.
Yes, then in that case, you can, instead of 24 hours, you can calculate it for like 20 hours or 22 hours. You can reduce the hours, sir.
See, what I do, sir, maybe I may be wrong, but what in my practice I do is, suppose the patient gets like.
It should be for everyone. Like Advaita Sambhasha. Please tell, sir.
Why I strictly follow Charaka's thing, that is the Shodhananga Sneha should be digested in 12 hours. Irrespective whether it is 3rd day, 4th day or 7th day. Right. So what I do is, if a patient digests 30 ml of Snehapana in 3 hours, for 12 hours he needs 3 into 4, means he needs 120 ml of Snehapana should be the Madhyama Matra dosa for that person. Right. Ideally, next day I should give 120 ml.
Yes.
But clinically, shifting from 30 to 120 ml is not possible. Patient are not cooperative. They cannot change that huge change. They cannot accommodate. So what I do is I do something in the middle. Depending upon patient, either I give 60 ml or 75 ml. Right. Technically, this 75 ml should get digested by say around 8 hours, because if you calculate it for 12 hours. But what happens if your Deepana Pachana is good, the patient digests this Sneha within that stipulated time, which is supposed to be around 8 hours. So he may digest it in 6 hours, 75 ml of Sneha.
Hmm.
So next day it is for 12 hours, it is 150 ml.
Hmm.
Like that I do. So it is again Vardhamana only. It is definitely it is Arohana Sneha only. So my basic criteria is fixing the dose for 12 hours digestion.
Hmm. Hmm. Hmm.
I do like this. So on usually on 4th day only I would have reached a level of 200 ml.
Hmm. Hmm.
So this is what I follow, sir. Because there is a concept when he says Neho Acha Shuddha hai Bahu. Why I don't follow this means, suppose if I give Bahumatra Snehapana in Shodhanaga Sneha,
Hmm.
it has to be digested in 24 hours, right? Isn't it?
Yes.
That means for another 24 hours, till the medicine ghee or Sneha get digested, he cannot eat anything, the patient.
Hmm. Hmm.
Immediately you cannot give Snehapana the next day without
Yes.
giving any food. So the logic of Sneho Acha Shuddha Bahu, it is a bit controversial. I think Buddha Vagbhata says Madhyama Snehapana only for Shodhananga, not
Yes.
Uttama Snehapana.
I also
So
agree to that.
this is what I follow.
believe
What
Madhyama
I
Matra
do
is
is
best.
S.J.A.C Snehapana I give. So next day I calculate for 12 hours. If possible, I will give the whole dose or I take a intermediate route. Like that, the amount of Sneha digested in time is converted in for 12 hours and next day I try to give that. So like that I have gone up to 250 ml in 5th day.
Yeah, that is,
And by this I am following Charakas. There is Arohana Snehapana also. I am not crossing the Kala Maryada of Madhyama Snehapana and I am able to achieve good Snehapana. I mean Sneha Lakshana.
yeah, that is absolutely no problems. As I said, the numerical value cannot be fixed. It is up to what I felt is I just see patient to patient, then I fix the dose.
No,
That's
why
it. I
my
don't.
question was, because many books it is stated that you calculate for on 7th day you calculate for 24 hours. Right. That basic idea itself, somehow I am not happy with the idea, sir, because Madhyama Shodhanaga Snehapana has to be digested within 12 hours only according to Sushruta also.
Yeah, yes. That's why I also told I agree Vagbhatas and Sushruta, because Sushruta also told, because for Shamana purpose, highest dose should be given. For Shodhana, Madhyama is best. Always I consider that also. According to that, your 12-hour calculation is, it makes sense, sir. Lots of sense.
This is what I have been following since long time, sir.
Yeah, this is actually a kind of what you are saying is, this is, I totally agree with you. This I didn't consider, I didn't thought about this. But now when you said it, it is flashing in my mind. Yes, instead of calculating 24 hours, yes, better, our best we calculate for 12 hours.
12 hours. And one more small question, if I am not wasting time. So, see, if Shamana Sneha Charakas, he says, it is Uttama Matra, means that which has to be digested in 24 hours, right?
Yes, sir.
What is the duration of Shamana Snehapana?
Pardon, sir?
What is the duration of Shamana Snehapana?
What is that?
Duration, time. How long it should be given?
How long it is, as I said, basically even for Shamana Sneha also, it should be 7 days only, maximum.
Maximum, but there has to be a gap of 1 day every time, every Snehapana you give. Because it has to be digested in 24 hours.
Yes, it should be digested in 24 hours.
And after the second day, it has to be given administered again.
Yes. So after the digestion of this one, then you give food, then it should be digested. Wait for the food is digested, then you go for the next dose. So in that case, what you're saying is correct. So 1 day Snehapana is given in 24 hours. Then you give 1 day Visrama, or sometimes 2 days also you need Visrama. Then you go for the dose. It should be like that. Whereas now we give 10 ml, 15 ml until
that is Brahmana, sir. That is always Brahmana. That is always
that's what I told. Yes, that's what I told. Yes.
And one more problem, sir. See, as far as my knowledge goes, Shamana Snehapana is supposed to be the most dangerous among all the 3 types of Snehapana.
Definitely. It is because the excellent dose and aversion will be more, vomiting will be more, if you give the proper Uttama dose. That is the reason why people don't want to take risk and they go for 10 ml, 15 ml and all.
Because Shamana has been told, I think in Sarpadamshra somewhere he says Shamana Snehapana, 3rd or 4th stage, I'm not sure. There it is the large quantity of Sneha which is given for the purpose of Shamana.
Yes. Definitely.
And that's why Charaka says, when he's speaking about Shodhanaga Snehapana, Nacha Ati Balahari. Means compared to Shamana Snehapana, Shodhanaga Sneha is much easier. It does not cause much balahani.
Yes, yes, yes. That is the
Technically,
reason
Shamana
why.
Snehapana is most dangerous than Shodhananga Snehapana. If you
Yeah.
practice as per classic.
Yeah, because of this reason only, they go for 15 ml, 20 ml and all. They are not giving that Uttama Sneha in many places. Okay.
Sir.
Whereas, where you want to give dosha shamana in some cases, especially Kushtanda, I practice like this. I know 1 or 2 days I give gap. Once again, I give Uttama dose. Then I give gap. Like that, 7 to 10 days I follow, sir.
Yeah, that should be
And
the
one more thing
ideal
in
way of
this
giving
also,
Shamana Snehapana.
when,
That should be
yes,
the ideal way
so
of giving
sometimes
Shamana
even
Snehapana.
I do. Pardon,
Okay.
sir?
That should be the ideal way of giving Shamana Snehapana, what you are telling. Giving gap and giving in
Oh,
high
yes,
dose.
definitely. That's what Acharya has told. It is not like 10-15 ml until Roga Shamanartham, nothing like that.
Yeah. And one request, what I just proposed, no, this Shodhananga Snehapana, if any of the participants who are participating here, if they can try in 1 or 2 patients, if they get back different way of Snehapana, Snehana, in a better way, if they give feedback to me, it will be helpful for me. Because this I have been practicing, I have been fighting for this since long time at various places, but nobody is ready to agree with my concept.
Sir, your concept is correct only. Why should they not agree? I don't think it is wrong. And, we are not against of Acharyas also, but we need to, as I said, we need to read in between the lines and nothing
that's
wrong
right.
with it.
If somebody can adopt this and get back to me with, I will just.
Sir, I am
put
already
my number.
adopting. I am practicing that. If you want, I can, show and I can, because this
What I
practically.
told you is 12 hours concept, I said, for deciding.
12 hours. Then I can do that. I have never practiced that.
Somebody can give me feedback. It will be helpful that what I am doing is correct. So at least another person is trying the same thing.
Yeah, yes, sir. So you take down my number, sir. Then we will keep in touch with both of us. Then why should we need others? We both will do. No, what is wrong in it?
Okay, sir. If you can give your number, it will be helpful. If you can post it also, I will get it in this thing only.
Yeah, I'll put it in the chat box. Okay.
Okay, sir. Thank you.
Yes, sir. Thank you,
Hope
sir.
I have not wasted time of any person.
No. Why, sir? We are all learned people, and it's Tadvidya Sambhasha Buddhivardhakanam Sreshtam. I believe in that, sir.
Okay, sir. Thank you.
Yeah. Thank you, sir. Then we will take the last question. Dr. Shraddha Vyas, please ask question.
Yes, Namaskar, sir.
Sir. Yes, madam.
Sir, I had a question that can Marsha Nasya be used along with Shamananga Snehapan?
See, Nasyam is always contraindicated during Snehapanama.
Okay, sir.
Yeah.
And what should be used as a substitute of Masaras during Sansarjanakram?
Which one, ma? Mamsaras?
Yes, for vegetarian people.
Yeah, vegetarian people, you can go for, Yusham or like sprouted lentil Yusham where you get more protein. That's it.
Okay, sir.
Yeah.
Thank you.
Thank you.
Thank you, sir. Please share your book details also, name also to chat box so everyone can buy the book. Now I request Dr. Satyendra Kumar Tiwari, sir, for vote of thanks.
Am I audible?
Yes, sir.
Okay. Good afternoon, everyone. It has been such an honor to be a part of this wonderful program. On behalf of the organization, I would like to extend my heartfelt gratitude to our esteemed guests and speaker, Dr. Chandramouleeswaran.p, who have shared their valuable information of Abhyantara Snehapana, that is commonly known as Snehapan, with us. I would also like to extend my sincere thanks to our National Executive Committee members, our Deputy President Guruvar Nigam sir, Lead Speaker Dr. Kendra Damat ji, our National Convener ji, Co-Convener Professor Santosh Chauhan ji, Coordinator Dr. Chetan ji, and all zone-wise coordinators. Finally, I would like to thank Professor Anil Shukla ji, and all of you present here for making the time to be with us today and helping us in making this program successful. Thank you, one and all. Good day, all of you.
Thank you. Thank you, everyone. Have a nice Sunday. Thank you.
Thank you, sir. Thank you.